Hello and welcome to episode number 143, where I chat with Dr. Sujatha Kekada about cysts and fibroids and endometriosis. We talk in detail about the menstrual cycle, the doses involved, the different conditions that affect the menstrual cycle. We talk about hormonal contraceptive pills and Ayurvedic guidelines for a healthy menstrual cycle and reproductive health. So please stay tuned. Hello and welcome to Elements of Ayurveda, Empowering Wisdom of Life. I'm your host, Colette, and in this podcast, I hope to empower you to take charge of your own health by sharing the holistic teachings of Ayurveda, the ancient healing tradition from India. We will also discuss topics like health and wellness, nutrition, yoga, fitness, meditation, breath work, and much more, as well as interviewing lots of inspiring people along the way. My humble wish is to help you to connect to your true nature, to Mother Nature, and to each other. If you like the content, be sure to subscribe to the show, and the new episodes will automatically download for you to enjoy. If you're new to Ayurveda, I recommend you listen to the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. I've also set up a Facebook group for us to connect and to support each other, and I'd love for you to join me over at Elements of Ayurveda podcast group. And now here's the show. Hello and welcome to Elements of Ayurveda. Today I'm very happy to welcome back Dr. Sujatha Kekada, who is lead Ayurvedic physician and co-founder of Amirta City Ayurvedic Clinic in Bali. Dr. Sujatha completed her Ayurvedic degree in India before relocating to Bali in 2004. And Amirta City played a big part in my healing journey. And Dr. Sujatha was my doctor and mentor when I arrived there for my first Panchakarma. And I spoke all about this in podcast episode number 5, Ayurveda and Healing in Bali. Welcome back to the show, Dr. Sujatha.
Thank you, Colette. Thank you. I really love what you do to bring awareness on Ayurveda and various ways of healing body, mind, and spirit. Good job.
Oh, thank you so much. I appreciate that. It means a lot. And in our last episode, Dr. Sujatha, episode number 134, we discussed perimenopause and menopause. And today I would like to ask you a variety of questions that I have received from listeners on various women's health issues. I get a lot of questions on these, and I thought it would be a good idea to put them all into one episode. So I appreciate you taking the time today to answer these questions.
You're welcome. Let's get going.
Exactly. Let's get started. So the first question I'd like to ask you about is cysts and fibroids. What are they and how do they form in the body according to Ayurveda? What are the dosas involved? If we could start there, that would be great because this is a really big question.
Okay. Cysts and fibroid. Cysts are basically fluid-filled sacs in our body. And it can happen in different part of the body, but more prominent, more clearly, they appear on our ovaries. Either inside the ovaries or outside the ovaries, like a little sac which contains the fluid. In a normal physiology, where ovaries form cyst, they call follicular cyst. Basically, when your follicles ready to mature and to release the eggs, it forms a sac as the follicles grows and the eggs inside grow. So this is called functional cyst. It is normal. Some women have a little bit bigger than the others. And during the period of the ovulation, if you look through the ultrasound, you may see this. But what happens in an abnormal condition, these sacs even still persist even after ovulation, and they can persist covering the whole ovary and creating or leading into hormonal imbalances and various mild complications, symptoms during the cycle of the menstruation. And fibroids, which are more of a non-malignant growth or mass in the muscle fiber of the uterus. basically abnormal multiplication of muscle cells in the uterine muscle or intrauterine wall start to happen, and it turns to grow into a mass, which can be like a centimeter long to 9 centimeter long, or could also be a size of like a big pomelo. So this is a abnormal growth. In both the condition, in the cyst and in the fibroids, the dosha in Ayurvedic way of understanding, it is both kapha predominant. Very much purely kapha in the case of cyst, where kapha is the element of earth and water. So the fluid gets stagnant, stuck, enveloped by a sac, and they just become stagnant there. So general increase in kapha in the body, or a woman with kapha predominance and kapha imbalance, stagnant lifestyle, or consuming food which increases kapha. Some easy examples are too much of wheat product, sugar, stagnant lifestyle, dairy products. Also, one important thing is using contraceptives. So basically, contraceptives, either it's rich with estrogen or progesterone, depending on what suits for you. Basically, you're kind of giving signal to your ovaries and uterus to function beyond what whole rhythm and the nature of the body wants it to do. And hence it produces cyst. So one of the main cause is contraceptives and increase of kapha dosha, kapha lifestyle, kapha imbalance in the body for both. A slight difference in fibroids, along with the kapha imbalance, it also becomes clear that vata imbalance and pitta imbalance do follow in the fibroid situation. As the fibroid grows, it creates blockages, flow of apana vayu is blocked. Hence, the fibroid can create irregular menstruation, lack of flow of the menstrual flow down, creating lots of pain, both in the pelvic floor, lower back, and also can lead into cause for infertility, where the space is occupied by the bigger mass, where the space was supposed to be for fusion of ovum and the sperm to create the zygote. So the space is taken by something else. So this can lead into fertility problems, or giving birth premature, or for miscarriages. All those things can be affected by the presence of fibroid. It also depends on how big the fibroid. Having said that, we also have had people who had fibroid and they got pregnant and they changed their lifestyle. The fibroid disappeared. They had a healthy pregnancy and given birth to a healthy child too.
Wow. Okay, so the fibroid disappeared in some cases.
Yes. Yeah.
Interesting. And so if a person has a cyst or fibroid, what steps would you recommend that they take?
Okay, totally. If you're looking into a holistic aspect, it's a stagnation. That's what it creates. Right. It's a stagnation in the body energy, like a chi, prana, whatever you call. It's not flowing. So it becomes accumulated. One thing is to healthier lifestyle choices, going for a diet which is more sattvic in nature, pure. Lots of vegetarian diet is really ideal. There's one concept in Ayurveda we call the mamsa dhatu, which is muscle tissue. So if you want to increase your muscle tissue, you want to eat food which is rich in protein. Animal protein is recommended. So mamsa increases mamsa. That means if you eat muscle or the protein, it increases muscle inside you. That's why if you look into bodybuilders or people who want to have a bulkier muscle, they go for high protein rich food, low carbohydrate rich food. So if it's already abnormality, stagnation in the muscle tissue, if you want to reduce that, you want to go for a more of sattvic diet, which contains lots of vegetables, lots of fruits, whole grains, not too much, but not to consume something which is heavy and difficult to digest, particularly animal protein, high concentrated protein rich supplements and food and things. This need to be reduced. Dairy need to be cut down. Wheat products need to be cut down. And exercise is very important. One of the high recommendation for kapha constitution or to reduce the kapha imbalance is high intensity exercise. So this is what is needed to break the kapha, have the flow, along with increasing the nutrients that's more alkalizing and lightens the body. That's one thing. Okay, lifestyle and the diet. Also, I've seen like a fibroid is a growth. It happens in the organ, which is supposed to create another life. What I've seen in people is something that you want to manifest as a person you are, either it's a professionally or spiritually or an individual level, that what you want to become, whatever that energy you want to bring out and give it to the world or to create and express, if you hold that back and if you did not do that for various reasons, that you had to support your family and you ignore your call, your self-expression, the deep desire that you always thought of wanting to do and express yourself, if you block that, somewhere else this creativity is that want to come out of you through to the world is going to get manifested inside. So whatever we suppress, block, it finds its way and it goes into the womb and start to become a create, because womb represent creation. It's the most powerful part for the women, that it creates.
Wow, that's so powerful. And the fact that, the womb, it's an open space for that energy to build up, to stagnate and so on.
Absolutely.
Yeah. And of course, if we're not, speaking our truth and living our truth, that energy gets stagnated in the body and then has an adverse effect on the body. Yeah. I'm so glad that you talked about that, because I think we get so fixated on diet sometimes and lifestyle that we need to think energetically what's happening too, and on a deeper level.
Very true.
Yeah.
Correct.
Yeah. So let's go forward now to the next question, which is on, again, an overgrowth in the body, endometriosis, which is a very painful disorder affecting many women. Can you tell us what is endometriosis and what's the Ayurvedic perspective on this condition?
Okay, endometriosis is a condition where the migration of endometrial cells, where it naturally need to be inside the uterus. It's a lining that prepares for conception. So estrogen is the hormone which is responsible for thickening your uterine wall, the internal wall. So it creates a thin membrane which gets thicker as the peak of the estrogen increases in your body, and waits as a cushioning space to receiving eggs and the sperm to with the conceived egg and the sperm. But what happens is there's a condition called reverse menstrual flow, where instead of menstrual flow moving downwards through the vagina and releasing the body, which is a function of, in Ayurveda, apana vayu need to move downwards, which makes sure the functions of menstruation, urination, defecation, release of flatulence, healthy sexual act, all those things are governed by. And when these functions happen normally, the apana vayu gets strengthened and becomes normal too. So in some conditions, when there is lots of stress or the apana vayu is not working well, this process of reverse flow takes place. And when this reverse flow takes place, the menstrual blood, which contains the torn, broken down endometrial wall, travels through the fallopian tube and it can get inside your body, outside of the uterus. So basically, this migrated endometrial cells can end up in your ovary, pelvic floor, fallopian tubes. Even sometimes it can migrate and reach in parts like to your lungs or other tissues. Wow. So this is basically because endometrium is responsive to the hormones. When it's outside your uterus, it has got no way to get out of your body. So it gets stuck inside your body, outside your uterus. But when it is in the uterus, as we have the menstrual flow, it leaves your body. So what happens is, in a regular menstrual cycle, this endometrium, which is outside the uterus, respond to your hormone. So it gets thicker as you're on an ovulation phase, and then as you're on a progesterone phase, where the endometrium starts to shatter down and tear, bleeding start to happen, because it's a highly vesicular structure, meaning it has got lots of blood vessels, endometrium. So as it starts to break down, bleeding happens, and it heals again, and the scar tissue forms. So that's why the endometriosis is a condition women experience a severe pain during menstruation. So as the endometrial membrane breaks down to create menstruation inside your uterus, the endometrial cells outside the uterus also cracks and breaks and start to bleed, and then clots happens, and then women experience extreme pain, bloating, difficulties, and painful menstruation. So this is what happens in the endometriosis.
And so upon a vayu, you say that energy, instead of going downward, is the reverse flow. So then we can conclude that Vata is involved in this?
Yes, endometriosis has got a Vata, but it can also be combination of 3 dosha in the later stage when it's manifested. So it primarily starts with Vata and then it becomes 3 doshic. Primarily, it is a Vata related. Vata is a primary cause. As you know, Vata is a notorious dosha. It's a moving dosha in the body. When it gets naughty and just leaves its place and moves around different part of the body, it encourages the other dosha like Pitta and Kapha to involve with that and circulate and create imbalance.
Right, and this is how, because Vata is responsible for movement in the body and of the other doshas, and this is how it, like you said, it goes into other tissues, it can go into the lungs, the pelvic floor, and so on.
Mm-hmm. Yeah. Exactly. With this, I want to stress one thing, because, see, the endometrium has to penetrate and go outside of the uterus without leaving your body. If you know, in yogic philosophy and in Ayurveda, it's highly recommended women not to do extreme physical activities, particularly in the time of menstruation. So anything you move extreme and intensity, it obviously increases Vata. And if your body is not capable of tolerating this increase in the force of Vata, it's going to damage, right? That's the one thing. And also it's recommended to not to do any inversions. Yeah. So when we do inversions, the apana is going in a wrong direction. So if you are menstruating and if you do inversions, you're going to force the blood to go through the fundus of the uterus and then to the fallopian tube, and then it has to go into your ovaries. So there's a high risk of women who are going to do yoga or any kind of intense activity, and particularly in yoga, if they practice any kind of inversion, it's almost like they're creating the possibility to create endometriosis.
It makes so much sense. And again, it's like the same with the end of the last question. You talked about respecting the energy in the body, and we really do have to listen to it. We're already living in a world that's very Vata aggravating. And so putting on top of this inversions during your cycle is going to increase Vata even more. And we're all highly, I think, already aggravated in Vata given the conditions in the world right now. So I think respecting the energy of the body is of paramount importance, isn't it, Dr. Sujatha?
Yes, it is. Because it's in nature, we have nature outside. It has got a cyclic rhythm of seasons, and, in the fall, the leaves fall off. In the spring, the new things comes up. Flowers, fruits. So it's the same thing. Our body has got its own nature too. And menstrual cycle is a different season changes within our body. So, which is something what happens in the menstruation time. It's a seasonal changes that we go through, and we got to respect that.
Yeah, absolutely. Now, you said that it's the endometrial cells are very responsive to hormones. So, could the contraceptive, birth control pills, and so on, could they have an effect on this condition?
Mm-hmm. The contraceptive pills can make it exaggerated, but at the same time, people use contraceptives to prevent this. So what they do basically is you use contraceptives that you don't get the period. So if in that way, basically don't let that cyclic pattern go. So it's basically you cease. So as a estrogen in our body helps to grow the endometriosis. So you keep the estrogen level high, and then you don't want the progesterone surge to happen. That means to reduction of progesterone. That's when the endometrial layers start to crackle and break and bleed. So when you do this hormone therapy, basically try to prevent this painful menstruation, and women end up with the contraceptives not getting the period. That means you constantly thicken the endometrial wall, but it doesn't crack. So if it doesn't crack, you don't have the progesterone surge, you don't get period, hence you don't experience pain, which can be a temporary relief. But on a long-term basis, you're totally kind of congesting your body with abnormal growth of cells where it should not be happening.
Right. And it's artificially propping up your hormones.
Absolutely. Wow. And it has got the other effect to different part of the body, because hormones are not only just related to creating your menstruation or conception, but it has got impact on the different part of your body too. Like estrogen is very responsible for your bone density, your mood, your energy, healthy skin, proper metabolism. So if you're kind of ignoring its effect on other part of the body, and you're trying to fix one thing using completely intervening with the natural cycle of body's changes by controlling the hormones, it affects somewhere else.
Absolutely, yeah. And so if you're on the contraceptive pill and it's giving you estrogen, you're building up the uterine lining every month, and then you're not getting that impulse of progesterone to shed the uterine lining. So is that just building up and building up all the time? Because you're never shedding,
yes, it is.
Right?
Yes, it's building up. And what I've seen in women in that condition, they never have a complete vent or a transformation of their emotions. It just builds up, and then it just, it's there. So they just become a volcano mountain of like a constantly irritable, snappy, when they don't have another way of processing their emotions.
Gosh, that makes so much sense, because it is such a release for women on their menstrual cycle. We have that emotional release as we start our cycle. And continuing on with the menstrual cycle, it would be great to discuss some other questions on this. And let's start with what happens with the body during the cycle and what doshas are involved. So if you could talk a little bit about coming into the menstrual cycle and what doshas are involved during different parts of the cycle, ovulation, and then the release of the uterine lining and so on.
Okay. The cycle of whole menstruation itself is a season, and it's been governed by 3 doshas. The state of where the bleeding starts, it's governed by Vata, as it's a flow. The tear happens in the endometrial walls, and it starts to flow. So Apana Vayu is very active. Vata helps to move the blood, which should not be stagnant in the uterus, out of the body. And hence it's a release. It's a completion of the cycle of Apana Vayu. In our body, Vata is responsible for all different kinds of movement, neurological, both motor and sensory. So Vata is classified into 5 different categories. So they're nothing but different areas. They are predominant and doing the function, and they transform themselves, starting with the prana into the apana. So that means prana vayu, which is in your consciousness, in your head, related to cognitive thinking, memory, all those things, in your nervous system, in your brain. And then, as you move down, then there is udana, then you have samana, vyana, and then apana. So this is a cyclic transformation in a day that needs to happen. So that means end of the day, like apana is kind of released and it's all ready and calmed down. So this transformation is very important. And with the menstrual flow, the apana just releases the body and it gets a chance to revive and get started again, which is our next stage, which is the kapha stage. This is from the time your menstrual flow stops, which is from anything from 3 to 5 days to 5th day usually, or even some women it can be the 7th day of your cycle, from the day it started bleeding to the 7th day. That's vata. And from there to the ovulation period, that's your kapha state. That's where the estrogen is predominant. Estrogen is a juice of female body. That's when we have the estrogen period. Our skin start to glow. We feel very moist. We feel very stable. We feel more confident, more joyful, more light. So that's the kapha stage. It's the nature of the kapha in a balanced state, very resilient, tolerant, patient, lots of endurance, lots of energy. Women feel much more energetic and positive during that period, from the day your menstruation stops until the ovulation. So it's a nourishing stage. Then kapha is predominant here, and that cycle is that's the most peak of women's energy and health and well-being. And once the ovulation is finished, and then from the ovulation time to the menstruation starting time, that's the pre-pitta. So that's when it's a time your uterus, what happens in the uterus is ovulation, you're over, and the endometrium is thick and cushiony to receive the zygote, and then the Pitta stage where it prepares lots of circulation and getting ready to prepare the placenta, all those things to building stage, transformation change. Absolutely, blood. And so much of circulation, that's Pitta stage. That's why during that period, there's a lots of Pitta symptoms that one may experience. A tendency for infection, acidity, inflammation when it is in abnormal. So when Pitta is out of balance, these symptoms women can experience right before the menstruation. So can feel very irritated, emotional, angry, snappy, all those things a woman goes through, more angry or controlling, sensitive. These things start to happen when the Pitta period of cycle. At the same time, during the Kapha stage, from the last day of your menstruation to until the ovulation happens, if the Kapha is out of balance, women can experience a lot of fluid retention, swelling in the body, heaviness, lethargy, unmotivated, very emotional, or don't have much of emotional tolerance. These things, as a Kapha imbalance, one can experience during the Kapha stage just before the ovulation period. And during the Vata time, when the bleeding period, one can experience extreme ache, pain, radiating pain to sometimes to your legs, stiffness, constipation, lack of appetite. These are the symptoms women can experience. So basically, the hormones predominates. If the first part of the cycle is estrogen, the last part of the cycle is progesterone. According to Ayurveda, Vata in the bleeding stage, after the bleeding to the ovulation, it's Kapha, and after the ovulation until the menstruation starts, it's a Pitta influence stage in the human body.
Brilliant. That's fantastic. Thanks so much for that in-depth look at that cycle. And so the Pitta stage would be what we would call PMS stage, those PMS symptoms.
Yes, absolutely.
Right. And so those symptoms, just to remind people, and thank you for detailing what symptoms would be in each stage, they would occur if that dosha is aggravated in your constitution.
Absolutely. So this is almost like your self-screening to know, okay, what doshas, why these emotions, why these physical symptoms I experience, that indicates that these doshas could be possible that we have imbalance in the body. And that's just reflected through our period cycle.
Exactly. And this is where we get a monthly report card on what's going on. So being really in tune to those subtle energies in your body, you can determine if you're having a lot of PMS, my Pitta is aggravated. There's something that I'm doing, eating, intensity in work or workouts or something is aggravating my Pitta, and so on with the other doshas. And can we talk a little bit, Dr. Sujatha, about the different problems with aggravations that show up in the blood flow? Because again, that's a monthly report card. What's happening with the actual blood? If there's scanty blood, if there's heavy flow, if there's clotting. Could you talk a little bit about that for us?
Yeah, sure. Involvement Vata, we see usually Vata when it aggravates, when your menstrual flow begins, or sometimes we start seeing spotting. Basically, what happens is your apana is not working well. The flow is not happening. So there is lots of constriction. So at this stage, women can start experiencing vaginal spasm or tightness in the lower part of your abdomen, ache, pain, and then the flow doesn't happen and apana is blocked. And then at some point, the momentum catches up and the flow happens, and the women start to feel better as soon as the flow happens. So if there is a vata imbalance, it takes a while for the flow to happen, spotting, scanty bleeding, even the period starts. Some women have a very little bleeding. So generally, healthy menstrual flow quantity during the cycle is anywhere from 30 ml to 50 ml. So, or in some cases, it has to be below 90 ml, which is an average case. If the flow is less than 30 ml, which is scanty, can indicate vata imbalance, and then also can indicate lack of blood, lack of iron, or a condition due to over excessive menstruation, you can have lack of iron and ferritin in your body, and that after a long period of the time, when it becomes chronic, you may experience a vata imbalance and creates a scanty menstrual flow, which is purely related to vata. In kapha conditions, menstrual blood may contain lots of mucus and clots, can be a bit more of a paler color, not bright red, not dark. Too dark colored blood indicates vata imbalance. So more in the kapha imbalance, it's mucousy and lots of clot. In pitta, as it involves lots of heat, the pitta menstrual blood can be really bright red, and can come with excessive flow and lots of heat and very strong metallic smell. In Ayurveda, we describe it's like a viscerogramda. It's like a bit more like a fleshy, bloody, metallic smell can be indicative of excessive pitta.
Okay, great. Thank you. That's really great explanation there, and that will help a lot of people. Okay, so let's talk about now conditions that can affect the menstrual cycle. So starting with amenorrhea, what is it and how does this manifest in the body?
Amenorrhea means disappearance of menstruation over 90 days. That means almost you should have had 3 cycles by that time, and you don't see that period happening. So it's not just skipping 1 month or 2 months. So we need to have, in a stretch for 90 days, you should not have your period. So that's the term used to say amenorrhea. This is an extreme vata condition. Basically, ovulation process doesn't happen. All the hormones are on the lower side. Hence, your ovaries are sleeping. The follicle maturation doesn't happen. And the ovulation doesn't happen, and the changes that need to happen in your uterus doesn't happen, and no menstruation. So it's not only related to just the ovary and its hormone, it can be related to your pituitary gland in the hypothalamus, the gland which gonadotropin releasing hormone. It can be deficiency if FSH, follicle stimulating hormone, or luteinizing hormone. Basically, these 3 are the hormones which tells the ovary what to do. Given by your pituitary, and it can be coming from there, and hence also can be reflectly further could be led by having hypothyroidism. So basically having hypothyroidism, all the nutrients. So the thyroid, simple way to describe the function of the thyroid is it helps metabolism. That means it helps the cellular intake of the nutrients and transform into energy and tissue. So basically when there's a hypothyroidism, everything is sluggish. It's like a traffic jam. Nothing, if a trucks are carrying all the nutrients and need to reach in 2 days to from a port of production to a consumer, it doesn't reach. So it's delayed. When this delay happens, all the signals of production of hormones can be delayed. Even though your hypothalamus is producing all the hormones, sending the signals to your ovary can be working well. But if there is a hypothyroidism, the intake of the nutrients can be slow, and your ovaries would not produce the hormones, or they produce very slow, and it doesn't reach the peak and the surge, how much it needs to happen. The force within for the changes to happen in the body is not enough. Hence, the ovulation doesn't happen, endometrium doesn't get thickened enough, and then they don't rupture to give the bleeding. Another situation is in amenorrhea, lack of body's fat. That's one of the cause. Like people who have eating disorders, or people are very high athletic. So in them, instead of estrogen, their testosterone levels goes high. When the testosterone levels goes high, the body has got more of a masculine tendency, and the men don't menstruate. So in that stage, there's no enough body fat to convert that into estrogen. Your hormones are made out of your body fat. That's also the reason in a condition like polycystic ovarian syndrome, women gain weight, or some people who go on contraceptives, they gain weight because it increases your estrogen. So, and it naturally increases the estrogen. That means your organs are not going to produce estrogen, because why should it produce? Because it's getting from outside. It's almost like you have a person who's don't want to work and you feed them constantly and take care of them. Why would they get out of the house and make their own money and take care of themselves? So your ovaries becomes lazy. Because of the hormone. So in amenorrhea, it's basically you don't have enough fat for the body to produce estrogen. So it can happen in extreme, anorexia, bulimia, and women who tend to be hyper physically active and athletes or do extreme level of fasting and cleanses. Right. So these can be one of the causes for amenorrhea. So which is something we can get back into normal once you tune back into your physiology, give the right nutrients. It takes time. So your period can come back.
Is it true to say as well that during the nutrition of the dhatus, that if the reproductive tissues are the last tissues in that refining process, that you have such a lack of nutrition that they then don't have enough? Would that be true to say?
Yes, it is correct, because in the dhatu nourishment concept, or the law how the dhatus get nourished, it starts with the rasa dhatu, the firstborn dhatu, and it seeps through all the different tissues. By the time it comes to the shukra dhatu, which is your sperm and ovum, if there is no enough nutrients, they dry up. And literally drying up means drying your juice, which is your estrogen and progesterone in your body.
Right, exactly. And for people who are not familiar with that nutrition of the dhatus, I did a whole separate episode on that, and I'll link it in the show notes. And of course, then, Dr. Sujatha, that's going to affect your ojas, right? Your primal reserve of energy.
Absolutely. If ojas is an essence, and it represents kapha. As you know, our estrogen is a kapha-based hormones, and hormones are like juicy. The female gonadotropins and female hormones are very juicy in nature. So if they are not enough, you would have lack of storage of this ojas, which is kind of can be used for anything into building and protecting intervention that our body needs. So there's lack of ojas. So when there is no ojas, your vata totally increases. That's when we become agitated, anxiety, all vata related symptoms start to creep in.
Right, exactly. So again, it has such a knock-on effect throughout the whole body, because the whole body's connected. And then moving on to dysmenorrhea, could you tell us what that is and how it affects the body and the doshas and so on?
Dysmenorrhea is a condition where the menstrual cycle, the actual flow of the menstruation, that period, just a couple of days before, or even some women can be a week before, and during the menstruation, the first 1 or 2 days becomes very painful to a degree that it becomes unbearable. Some women have severe symptoms of headache, nausea, feeling, lower back ache, radiating pain to the legs. They basically become debilitated and they need to spend a day or two in the bed. We're not talking about the simple PMS symptoms of, we feel a bit emotional, irritable, a little bit of cramping, a little bit of bloating. This is a severe pain. They basically cannot function. Primary imbalance is vata, and the secondary imbalance here is kapha too, creating lots of spasm and congestion. So the menstrual flow doesn't happen, and as it gets stagnated there, it creates inflammation, and the symptoms become even stronger and increase. So creates inflammation as a result of the menstrual flow doesn't flow through the vagina and getting congested. So spasm and congestion, two things. Spasm comes from vata, and the congestion is influenced by the kapha.
And then would that cause, you mentioned inflammation too, and the pain. Is there some pitta involved in that as well?
In the later stage, the pitta involvement. So here the congestion creating a mild inflammation. It's not like a pitta burning. Symptoms are much less. Okay.
Thank you for sharing that. And then the next one I wanted to cover was metrorrhagia. Is that how you pronounce that?
Metrorrhagia.
Oh, metrorrhagia. Okay.
Metrorrhagia is simply means heavy menstruation or menstruation in between the cycle. So other than the regular cycle, period you have got, the healthy cycle is considered to be 28 days cycle. And even after you had your regular cycle, in between the cycles, you may have a menstruation that's also called metrorrhagia, or heavy period, that you may get your period on a regular cycle just once in 28 days, but the flow can last longer than 7 days. So this condition is called metrorrhagia. That means the amount of the blood that discharged through the vagina can be more than 90 ml for a cycle. And that indicates heavy loss of blood. And this is purely a Pitta condition. So, and there's some extent Vata, because anything to flow extreme, anything which has repetition, long time, that Vata is always involved. So primarily starts at the Pitta imbalance, too much of heat, too much of inflammation, too deep rupturing of the walls of the uterus or the endometrial walls, and then creating severe bleeding, which can be related to hormones. Any of these conditions we talked about, like the dysmenorrhea and particularly metrorrhagia, has got much influence for the intake of hormones or hormonal imbalance, whether it's from the contraceptives or other lifestyle choices, stress, emotions can create metrorrhagia.
And so can this lead to anemia because you have a severe blood loss, obviously fatigue?
Yes. If it goes for long, unchecked, women can have anemia. So, which maybe not like, first 1 or 2 cycles you may see it, but if it continues for longer, women can suffer from anemia from the overloss of blood. And it can be, fatigue is one common. Two commonly seen symptoms are people anemic, and very tired, no much of energy, weakness, lethargy, these symptoms.
Right. Okay. And so with all these symptoms, oftentimes women are put on hormonal contraceptives to correct not only period problems, but you also talked about earlier endometriosis and problems with the skin. It was often a solution given like, oh, we'll just put you on a hormonal pill and it'll take care of that. Can you talk a little bit about that? We did discuss it earlier, the problem with this, like artificially propping up the body, but maybe talk a little bit about that and why it's not really getting to the root of the problem.
Like a contraceptive pills or hormone replacement therapy. Contraceptives are used in women during the menstruation. They're actively menstruating, and hormone replacement therapies are used when the woman goes through the menopause. So both are hormonal intervention. It depends on what time of the year you do and what combination. That's what the difference between the contraceptive pills and the HRT. Like what it does is it basically tells your body to stop doing what you're supposed to be doing. And when your body is not doing that and you bring somebody else, a physical aid, like you bring someone else to say, okay, do the job now. So without rehabilitating the organs, which are not doing its function, you just give a external support. Maybe in the beginning, in my opinion, that it may be of beneficial when you're suffering, going through extreme debilitating symptoms and challenges and stuff. But on a long-time basis, you leave the original cause which created that leading into this imbalance in your body. Basically, also the hormone pills in the menstruating time in the young teenage girls, it's been started as more of a aesthetic, like a acne, which is a common thing. And they kind of figured out that, okay, taking hormonal pills, particularly something to do with estrogen, you're going to reduce acne. Yes, it does reduce acne, but it really makes your ovaries lazy and creating a lot more other problems as you grow older. Some of the side effects or the adverse effect of being on contraceptive pills are like a heart condition, increased cholesterol level, plaque buildup in your arteries, mood swings, weight gain, predisposition for diabetes, tendency for like depression, anxiety. These are the common things that can lead to make yourself vulnerable for. I'm not saying that you will get this, but you are more vulnerable for these conditions, and osteoporosis in the later stage of your life.
Right, exactly. And so what Ayurvedic principles would you recommend for a healthy menstrual cycle? Maybe talking about lifestyle and food and herbs and spices. What does Ayurveda recommend for a healthy menstrual cycle? Of course, if you go for a consultation, each person will get a tailored approach, right, for their unique constitution. But in general, could you give some advice to people today, please?
In Ayurveda, we consider menstrual blood is a upadhatu, like it's a outcome of your rakta dhatu. That means if your blood is formed healthy, it is not contaminated by too much of vata, too much of pitta, too much of kapha. The product of menstrual blood is going to be healthy and normal. So that means in your nutrition, you want to make sure your blood is alkalized in a common language we're speaking. Blood has got all the nutrients that you need, and your cells are not clogged. In naturopathy, you diagnose the state of your health by microscopic analysis of your blood cells. If the blood cells are not sticking together, clean, floating very well, structurally intact, and have the compact shapes, it's considered to be healthy. That means it doesn't have any kind of impurities or too much of acidity, or in Ayurveda what we call ama. So ama is sticky, gluey substance. So it clogs when it is in the blood. It clogs the cells and bind each other. So hence the blood cells doesn't carry enough oxygen to circulate to different part of the body, and they basically not doing the function. They're sluggish and heavy. So that means in order for us to have a healthy menstruation, we need to focus on our nutrients, good exercise so that we have a good oxygen for these cells our hemoglobins are happy and carrying all the oxygen it needed to circulate to different part of the body. It's not acidic. It's not clogged up. It's clean flowing. If we could just bring our attention to keeping our blood healthy, simple, then I think that's a simple step we can take. In order to do that, regular exercise, respecting the rhythm of the nature or the rhythm of your body. That means waking up at the time when your body is supposed to be waking up, and giving it rest when it needs to be. For example, waking up in the vata time, because that's where the body is alert and active. So it tells the signal. So, we've been on the sleeping state where your melatonin is dominant. And as soon as the sun comes up, it kickstart into adrenal state. That means it's an active state. When we wake up with that state, the nature's force is, giving a push for us. But if you don't get up and start your day with, some gentle exercises and some light food, and then getting our day with work, and then finishing off our day and relaxing, giving enough rest, and eating when we're hungry. If we could do these basic simple things and allowing nothing to congest and nothing to tighten up in our body from the stress, I think our menstrual cycle can be very easy, because it's meant to be like that. Exactly. So it's already planned and created. We just have to create the right environment that it can be continued and kept.
Absolutely. And I think it's really important for people to understand their constitution and their tendencies, understanding how to exercise for your constitution, the circadian rhythms, regular cleansing, and really being in tune with your body and mind, doing that self-study and getting that advice on what's best for you.
Absolutely. And it's not difficult, because it's a natural rhythm. We have it. So it should not be. And having a painful menstruation or challenge, which is not normal, and taking pills to take care of the pain is also a way of we kind of accepting something which is not working in our body to its best, and trying to patch up. So it's just going to create a deeper scar inside us and manifest into something else.
Right. And people need to understand that these PMS symptoms are signs of aggravation in your body. They're not normal. We've come to make them normal and have created pills for them in our society, but they're not normal. They're signs of aggravation.
Absolutely. I just want to add another thing, Colette.
Please.
How to have a healthy menstruation. Okay, these are the things we do in order to take care of our general health, and it will reflect on our menstruation. And also during menstruation, it's also important to, it's a Vata time. So that means we need to be taking care everything to balance Vata. That means more relaxing. That's also the reason, the me time, the chill out time, or the red camps. That's something in some Asian traditions and some ethnic groups. There was a practice of, women during the menstruation, they all spend time together in a tent, and they don't have the responsibility of their normal life as their mother or the wives or daughters to taking care of the whole family and preparing food and running the household. So they get a break from that. That means any kind of tedious works, physical endurance, all those things to be put aside, and you want to be given care and nurtured during this period where your body is exhausted because it's a period of Vata. So anything you could do to chill and relax and not push yourself during that period, and preparing that a couple of days before and focusing that during the first 3 days, it's already you're kind of recorrecting any imbalances that may be present.
I love that. It's such a great reminder. And of course, in our society where it's all about being productive and go, 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 that we have to remind ourselves that it's important and that we have permission to take these few days. And like we mentioned earlier, it's an emotional release, and releasing that emotion, whether it's journaling or in some creative activity, but just taking time to go inward and release the emotion and then rejuvenate for the upcoming month. I think it's such a powerful cycle, and I think it can really help and support us in our lives.
Definitely. Yeah.
And so during the cycle as well, the digestion can be a little bit affected. So I guess eating easy digestible foods. Is there any spices that you recommend, like with things like fennel, which is good for digestion but wouldn't really aggravate Pitta? Is there any other spices that you would recommend?
I think various, depending on what's constitution, people have a digestive things. Like a Vata usually tend to have constipation. At that time, taking triphala or soaked prunes or raisins, eating lots of cooked apples, spinach or watercress, these things in your diet, drinking lots of tea made out of fennel and cumin can ease in the flow, reduces the spasm which is created by increased Vata. I think in Pitta constitution, they may experience bit of bloating, bit of diarrhea, burning sensation. So you want to do things to cool down your system, but you need to keep in mind that you don't want to aggravate the Vata. So basically, because if you aggravate the Vata, then it can delay the flow of the menstruation and creating spasm-related trouble and delayed flow of menstruation. So there you can look into using peppermint teas, licorice teas. These things are anti-inflammatory. They cool down. Coriander, these kind of food in your diet can simply reduces the Pitta. If it's a Kapha involvement during actually the ovulation period, if you experience congestion, bloating, things you can do is taking some ginger tea, having good physical activities and exercises, vigorous exercises recommended on in the Kapha period of the time, so that you can break the stagnation off, break the excessive mucus that you might have accumulated in the body. Basically, you burn. So hence the ovulation becomes easy and you may not experience any Kapha related trouble. You might have other questions. So I just wanted to touch base related to what Ayurveda does in conditions of endometriosis, or it's a amenorrhea, or it's a metorrhagia. So when this stages appears, this is beyond the early stages of dosha imbalance. So this is a manifested condition. In this manifestation condition, the diet and lifestyle changes may not give the result. So I'm not saying this is not beneficial. Of course it's beneficial, because the line of treatment is like this. So when you know what's going wrong with you, you identify the causes, you stop the cause, and then you want to start reversing. So the reversing process would involve stopping the cause means stop everything that you did which was not beneficial to you, and you want to take activities which are totally opposite of those. That means you start to reverse. So whatever the changes you're going to make with diet, lifestyle, and awareness, it's already prevents it from further getting worse and also slowly start to heal. But the manifested disease to change, you probably need, in order to make it more quicker, more efficient, and to not to lose hope while you're making changes, you might need some external support from an Ayurvedic physician or from a naturopath through herbal supplements, different kinds of vitamins and minerals, which could be supportive. Another process is, like in cases of endometriosis, in cases of ovarian cysts, amenorrhea, there's different process. Like if panchakarma is a line of treatment. If you're not in a facility where you can do panchakarma, then at least visiting an Ayurvedic doctor, taking recommendation, figuring out what's your original constitution is, what doshas created the imbalance, and what the lifestyle and other things in creating this imbalance or a manifestation of a disease, and then treating and taking care of the health was definitely a solution. No need to really continue to take contraceptive pills because I experienced dysmenorrhea, painful menstruation. This is kind of you putting a lid on some bigger problem and allowing it to pop up in another way. Common things other than the panchakarma process, herbs like ashoka, hibiscus, fenugreek, licorice. These are the very well-known herbs recommended in female health, women issues, including very particular herbs like shatavari and ashwagandha. But I would not recommend, except for ashoka, I would not recommend just to you go and buy these herbs and start taking, because they work differently for different constitution, different condition. For example, licorice, which is a anti-pitta, anti-vata herb, they have very soothing effect on inflammation and in your uterus. But if you are a kapha constitution person and you experience pain, maybe related to kapha congestion, and you can worsen your situation. So it may be not ideal. So ashoka is a 3-dosha balancing, a tonic for female disorders. So it can be consumed in any three dosha imbalance, creating the menstruation cycle problem. Other than that, any herbs I have mentioned here, always go and see a doctor, or if you have studied Ayurveda, you mostly understand what's going on and you can choose accordingly, then you can go ahead with that.
Yeah, thank you for mentioning that. I think it's a wonderful reminder that, there is the possibility now to buy these supplements online, but it's so important to get professional guidance because you could be doing more harm than good. Yeah, so really important. Dr. Sujatha, that was fantastic. Thank you so much for all that information. I think you just gave a great insight to all these different conditions. And I know that many listeners were sending me questions on this. So I truly appreciate you taking the time to share that information. And if you could tell us now where people can go to find out more about you, Dr. Sujatha, your Ayurvedic clinic, Amirta Siddhi in Ubud, Bali, and where to book their treatments and so on.
Okay, thanks, Colette. I'm based in Bali, in a little town called Ubud. We have an Ayurvedic center. It's more of a healing panchakarma center. People come and stay and go through the different healing process, both body, mind, and spirit. And you could find us online, www.amritasiddhi.com. Currently, due to the COVID situation, we have started offering online consultation and online home-based detox programs. If anybody interested in doing a detox program or getting a consultation to find further about any of the illnesses or imbalance that you're facing, definitely team of our doctors, including me, we can guide you through to finding your right balance and having a solution in your hand. Thank you.
Wonderful. And I will put the link to Amirta Siddhi, Dr. Sujatha's website, in the show notes. Always a pleasure, Dr. Sujatha. Thank you. You're a wealth of wisdom, and I appreciate you sharing with us today.
Thank you very much, Colette. Thank you for inviting me.
My pleasure. And we'll chat again soon.
Sure.
Take good care of yourself. Bye for now.
Bye-bye.
I hope you enjoyed that conversation with Dr. Sujatha, and it was wonderful to get all those questions answered because I've received a lot of those questions from you. So I hope you found that helpful. If you have any comments or feedback, please check out the Elements of Ayurveda podcast Facebook group and let us know your thoughts there. Also check out Dr. Sujatha's website, amirtacity.com. I have the link in the show notes. And if you haven't already done so, please subscribe to the podcast so that the new episodes will automatically download for you. And if you haven't yet rated and reviewed the podcast, wherever you listen to your podcast, I would appreciate it. Also, I have a Patreon page. If you want to support the podcast, if you're getting value from it, then you can leave a tip in my tip jar over on the Patreon page. And I just want to thank you. I want to thank you for listening, for your support. And if you want to introduce other people to the wisdom of Ayurveda, please share an episode with them. And this great ancient wisdom out there, I think it can really help us at this time in the world. Take good care of yourself. Be well, and ciao for now.